Let me make this perfectly clear. If we do not implement the program we have created, the measures we recommend, and which the German government has also adopted, if we do not manage to reduce contact between people for a few weeks, then it is possible that in 2 to 3 months we will have up to 10 million infected people in Germany. This will be a considerable burden on our health system.
Our chief political correspondent Melinda Crane is covering the story. Melinda, are people in Germany largely following the measures prescribed by the government?
It's a very mixed picture. On the one hand, 80% of Germans say that they find the measures correct and that they think they're necessary. And officially, many measures have been followed. For example, schools are shut. Most bars and restaurants are either closed or largely empty. Large events are being canceled months into the future. But informally, the picture's pretty different. I just came here on my bicycle through beautiful sunny parks and streets, and there were a lot of people out who were definitely not following social distancing precautions. Nearly 25 men watching and or playing soccer, for example, spontaneously on a soccer pitch. Groups of people sitting in the sun, chatting. All of those are potential infection chains. And when we also look at the surveys of people here in Germany, many younger people in the 20 to 29-year-old age bracket say they're not taking it quite so seriously. Now, the fact is, those young people probably wouldn't get very ill if they caught COVID. But they are super carriers, as it's known. That means they can infect a lot of very much more vulnerable people. So they need to be following these measures. And if they're not, we may see stricter measures put in place.
That is what I wanted to ask you. There's a lot of anxiety. Many people are wondering whether the German government will impose a lockdown the way that is already in place in Italy, Spain, and France. Are there any indications that the German government will take that step?
It's certainly not impossible. I don't think we're going to hear the Chancellor say that this evening. She is going to be speaking once again to the nation, but we're told it will be an appeal to Germans trying to explain why the measures are so important and why they need to follow them. But certainly in the government's toolbox is that complete lockdown, that prevention on people leaving their homes for anything but the most urgent business. They would probably need to declare a national emergency to do that, but certainly other countries have done it, as you said, Italy, Spain, France. So we may well see that happen here.
Borders are already shutting down around Germany. Germany has 9 direct neighbors. What impact are those border shutdowns having?
Well, amongst the impact is that Germany has just announced, as you said briefly at the top of the show, that it will not be taking in any more refugees or applicants for refugee status in its Syrian resettlement program. Now, the Chancellor did speak yesterday to the leaders of Britain, France, and Turkey about this very matter. Turkey certainly would then face a much bigger burden in terms of the large numbers of people leaving Syria for Turkey. The Chancellor has said she would be willing to see Turkey given more financial support to handle that burden, but that's just one of many consequences that we are seeing.
A fast-moving story. Melinda, thanks for bringing us up to date. That is our chief political correspondent, Melinda Crane. And let's get an update on the latest we know about the coronavirus. We are starting to understand more about it. A new study has confirmed previous estimates that the median incubation period for the virus is 5 days. Patients are most contagious just before they start showing symptoms and in the first week of symptoms. The virus cannot be spread by patients' stool. That's good news for caregivers and hospital workers. Authorities caution that the drastic measures taken worldwide to try and contain the spread of the virus could be extended and last for months. Our science correspondent, Derek Williams, has been tracking these developments all along. Derek, this new study out of Australia, it's providing some insights into how the body reacts to COVID-19. What have we learned from it?
Well, this study, which was published a day or two ago in Nature Medicine, which is a highly respected scientific journal, basically focused on a single patient who contracted COVID-19 in Wuhan but only fell ill with it when she was in Australia. Now, the researchers said her case was mild to moderate, but she was hospitalized. But she didn't receive any drugs, and she didn't have to be put on a ventilator. So despite her hospitalization, she had a less severe form of the disease. What was new and important about her was that the team of scientists there was able to study her immune response to the virus in detail. For example, through blood samples that closely tracked when she began to develop antibodies against the disease, and whether they continued to be present after the infection ran its course. So it also told them, at least in this otherwise healthy patient, which kind of immune cells appear and when. So they were able to describe the woman's entire immune response in pretty great detail.
Okay, this is just one particular case, though. How will information like this help us fight the disease?
Well, knowing how immune responses work and when certain processes activate during an infection in a healthy patient's body is important for several different reasons. First, because when I say healthy patient, I mean a patient who, going into the infection, was a relatively healthy individual. First, because having that information potentially allows us to develop tests that will let us track the progress of the disease in patients more or less in real time. See, that information can be vital in terms of making decisions about when to do what in the course of the infection. So the data could also, in the long term, help us with vaccine development. It could provide some clues as to how and to why some people react to the virus more seriously, for example, than others. And last but not least, it could help us understand exactly why the immune response is weaker in some patients.
Of course, a lot of studies of the coronavirus are currently underway. What else have we learned so far?
Well, another very interesting study published recently that came from researchers here in Germany was aimed at addressing a few other vital points. For example, it provided much more precise data on exactly when patients are most contagious. The researchers eventually tracked viral activity and the virus's ability to replicate over time and in different parts of the body. And they looked closely at how the disease might be passed along, studying viral loads in a group of patients that over time in a wide range of potentially infectious material, like from mucus and blood to urine and to stool. And their findings suggest that people are most contagious before they have the disease. They also discovered that the virus reproduces in absolutely huge amounts. In their patients, they found up to 1,000 times more of it in some cases than were usually found in patients infected with other related pathogens, like the SARS virus. That might explain why the new virus is also so infectious. Finally, as we heard just a while ago, they were able they found viral genetic material in stool, but they also were able to determine that it wasn't active. So that's good news that will have ramifications for medical staff and for caregivers as we move forward and more people are infected. So fundamental research is moving forward, the kind of research really that in the long run is going to help save lives.
Good to hear, Derek. Our science correspondent, Derek Williams. Well, as I mentioned earlier, much of Europe is in lockdown, but EU countries aren't the only ones hunkering down. The U.S. and Canada, which share the world's longest land border, are working out the details of banning all non-essential travel between the two countries. British Prime Minister Boris Johnson has hinted that the UK might also have to close its schools, as is already the case in many other European countries. The Czech government is ordering its citizens to start wearing face masks or something else to cover their mouths and noses when they go out in public. And Japan's Deputy Prime Minister says holding the Summer Olympics would make no sense if countries can't send athletes. But the government says it's still working to hold the games as scheduled. Well, doctors and nurses are at the forefront of efforts to save lives. In Europe's worst affected country, Italy, more than 2,500 health workers have tested positive for the coronavirus. The northern region of Lombardy, which has been at the center of the outbreak, is appealing to recently retired doctors and nurses to return to work to help overwhelmed colleagues. We take you now inside an intensive care unit in Italy.
The camera follows Carla Mastrini into the epicentre of the coronavirus crisis in northern Italy, a hospital in Cremona in the Lombardy region. She explains what she must wear to keep safe.
Surgical gloves, shoe covers, headgear, special gloves that are different to the ones I've got on now, and most importantly, face masks and protective glasses.
Mastrini and her colleagues have lost count of the number of hours they've spent treating patients in the intensive care unit. Patients are connected to ventilators while lying on their stomachs. The pressure makes it easier for oxygen to enter the bloodstream. At least that's what's supposed to happen for people suffering from pneumonia. But now the method isn't working and the doctors and nurses can't explain why.
Unfortunately, we haven't seen anyone recover yet in this hospital. Ideally, we'd like to take some patients off the ventilators and see whether they get better. We need a successful case to know that we're doing the right thing.
Up until now, Mastrini says 107 patients have already died in this unit of the hospital, out of 854 people who were brought here.
We've had several deaths and it's really wearing us down because we're thinking we're not in a position to do what we're here for, treating patients so they get better. We're watching them die and inside we're dying too.
The hospital in Cremona has been taking in coronavirus patients since the beginning of the outbreak. Outside, they've set up tents for triage, sorting patients for treatment.
What shocks me is that we have no power in the face of this emergency. Of course, we're used to dealing with severely ill patients who are close to death, and we know what our job is. But we've never had such a rapid influx of people in danger of losing their lives. It's hard. It's hard for everyone.
The death rate is significant, but there has been one ray of light here today. A 23-year-old man made a full recovery and was able to leave the hospital.
At night, I collapse on the sofa. I sleep, but not well, because I'm waking up every hour with nightmares. My husband and daughter wait at home for me. They try to talk to me, but I don't really take it in. They ask me if I'm listening, but I can't. It's terrible.
Carla Mastrini will keep trying to help and to heal. That is her job at the hospital in Cremona, the epicentre of the coronavirus crisis.
We'll be looking at some of the economic fallout from the coronavirus crisis in a moment. First, let's catch up on a couple of other stories. Former Vice President Joe Biden has topped the poll in the three latest Democratic presidential primaries in the U.S. The voting went ahead in Arizona, Florida, and Illinois, despite fears about the spreading coronavirus. Ohio postponed its scheduled primary due to the pandemic. BMW is shutting down all car production in Europe and South Africa until at least the end of April. The German car maker said it needs to protect the health of its employees. The company already had at least 3 identified cases of coronavirus at its research and development center in Munich. Earlier this week, Daimler and Volkswagen also announced shutting down plants. Well, the airline industry could collapse without significant help from world governments. That's the dire message from the International Air Transport Association, a body that represents the vast majority of global air traffic. Well, the IATA says companies will need between $150 and $200 million to weather the pandemic, and that the carriers are short of cash to provide refunds. Especially hard hit are airlines that rely on the lucrative transatlantic route. Last week, U.S. President Donald Trump banned most incoming flights from Europe for 30 days, and the U.S. is imposing, the EU rather, is imposing limitations too. German Chancellor Angela Merkel now says non-EU residents will not be allowed to enter the bloc for the same period. And it's not just weakening demand that's hurting the industry. Plane makers are cutting production as a result of supply chain disruption and employee absences. In the U.S., Boeing has already asked the White House for assistance. And here in Europe, Airbus has halted production in France and Spain. Well, Christoph Kober from our DW Business team joins us now from Hanover. Christoph, airlines are in free fall. How are they coping with this?
Rather badly, Terry. Several carriers have now halted their operations altogether. Lufthansa subsidiary Brussels Airlines and Austrian here in Europe, for example, Egypt Air also halting operations, and industry experts are saying there'll be more to come when we look at these cancellations and stopping of operations altogether. A growing number of governments is now rushing towards the airline industry in order to help them. There's talk about financial aid, financial help. Australia being one of the most recent countries to provide financial aid to the sector. EU transport ministers are talking about tax relief for the aviation industry. And in the United States, sector executives are due to speak with President Trump about the matter today.
Now, airline executives, not surprisingly, are saying that this is the worst crisis to hit their industry ever, worse even than 9/11. Tell us, what is it that makes this situation so exceptional?
Well, because the countermeasures to fight the pandemic, they are laying hand to the very root of the aviation industry's business model. If you're told to stay at home, if you're told to distance yourself, if countries seal off their borders, and if there's a persistent fear that intercontinental travel will contribute to the spread of the virus, all of that is a direct blow to everything that the aviation industry stands for. And if we talk about the 9/11 terror attacks, after those, heightened restrictions and security measures were put into place, all of which we've come to terms with these days. But these moves, these sort of measures, they don't work in this case. And then there's the time frame. Again, if we look at the 9/11 attacks, the heightened security measures were implemented fairly quickly after that and took effect fairly quickly after that. Whereas here, the virus could be spreading for months, possibly even longer, and the airline might have to deal with the consequences for that amount of time, which is an incredible burden for the industry.
Speaking of consequences, what options do the airlines have then? Christoph, they'll be going, some will go out of business, won't they?
That is the fear, and that's what industry experts expect. I mean, there's a number of options, none of which are desirable. I mean, we see some of those, the grounding of the fleet, the cutting of flights, severely limiting the service, also putting staff on reduced work, on reduced pay, cutting jobs, as KLM and British Airways have announced. There is another way to address this crisis here by amending the terms and conditions of bookings, for example, letting passengers letting them book with more confidence in the sense that passengers are allowed to just change their route of travel up to the very last day on very short notice without having to pay anything for it. And of course, there's the cry for government help. We talk about tax relief, we talk about the relief of fees, and obviously direct financial help, all of which is being discussed right now, some of which has been granted.
Christoph, thank you very much. That was our business correspondent, Christoph Kober.